Hello, thanks again for coming to Cancer Logic. My name is Dr. Karn Log, and I'm a cancer specialist practicing in Colorado. And what I'm going to talk about today is the basic information you need to know in order to treat breast cancer. You know, what we know is that 1 in 8 women will unfortunately be diagnosed with breast cancer, so either you or someone you know will be affected by this disease. And this video is basically aimed at, how do you approach breast cancer, and what is the basic information you need to know when you're talking to your doctors. So an important aspect is that when we talk about breast cancer, well, first of all, how is it diagnosed? So there's an old saying that we have, and it's that if cancer is the answer, then tissue is the issue. So when we talk about breast cancer is what we call a pathologic diagnosis. So the only true way that we actually diagnose breast cancer is by actually getting a piece of it, and that's by doing a procedure that we call a biopsy, where they'll usually take a needle, insert it into the tumor to definitively prove one way or another whether or not it's breast cancer itself. So once you get the diagnosis of breast cancer, then there's 3 main pieces of information that you get from that pathology report that are then important in determining how aggressive the disease is, and in the future actually what type of treatment options you have. So the 3 key points that you get from the biopsy are, is the breast cancer, does it express what we call estrogen receptors, progesterone receptors, and also something that we call HER2. So to take a step back, one of the ways to think about cancer and what is cancer is that cancer is rapidly dividing cells. And so with breast cancer, one of the things that we've started to ask is, well, how did these cells actually start dividing in the first place? And so what we've actually discovered is that estrogen and progesterone are stimulators that help create the growth and tell these cells, or breast cancer cells, to grow and divide. And so one common misconception is that estrogen does not actually cause breast cancer. But what it does do is that it feeds an existing breast cancer that's there. So again, an analogy that I like to use is, imagine that you've got a garden, and all of a sudden there's a weed that pops up. Well, nothing caused that weed to be there. The weed just happened to pop up. But if you fertilize it, if you water it, then the weed will ultimately grow and blossom. So that's the same thing that estrogen and progesterone are doing, is that they do not cause the breast cancer to be there, but if a breast cancer is there, estrogen and progesterone essentially feed or fertilize the breast cancer to continue growing. So knowing that the breast cancer is responsive to estrogen and progesterone is a big factor in actually determining the treatment. And again, you get that in the initial pathology report. But another way that we've started to see breast cancers grow is that, again, naturally your body has a mechanism that tells cells to replicate and divide. And one of the proteins, or one of the things that we've seen, or switches to help activate breast cancer, is this switch called HER2, HER2. And what we've seen is that some breast cancers have this protein that's activated that also tell it to grow. And so knowing the estrogen or ER status, the progesterone or PR status, and the HER2 status are huge important indicators that are seen in the initial pathology report to help determine the type of treatments you may need to go through. One important aspect is you can have positivity or negativity of each of them. So you can have ER positivity, PR positivity, and HER2 positivity. You can also have negative aspects of each of those. You can have one that's ER positive, PR negative, and HER2 negative. And again, a combination of each of those 3. One thing that is important is that if your cancer happens to be what we call triple negative, that means that it does not have any ER, does not have any PR, and does not have any HER2. So what that means is, it means that there is a different mechanism that is causing your cancer to grow. And typically, if it is triple negative, then that means that we would typically be using chemotherapy in order to treat your disease. Okay? So after you get the pathology report and you get the ER, PR plus HER2 status, the next important thing to remember is, well, then how do we ultimately treat breast cancer? The way that we treat breast cancer is it is typically a three-pronged approach. One is surgery, one is radiation, and one is systemic chemotherapy. So each treatment modality has a different purpose. So again, one way to think about it is when you think of surgery and radiation are considered local therapies. So again, if I have a breast mass or tumor, if I surgically remove it, then I'm surgically and physically removing the mass and the cancer that's in that breast. Well, again, I can also do radiation. So the idea behind radiation is it's basically killing cancer cells in a specific area. So typically if someone has breast cancer of this breast, then what we'll do is we'll radiate this breast and eliminate cancer cells that are in this vicinity. So surgery and radiation are, again, local therapy. So they only treat breast cancer that's in this area. Chemotherapy is what we call systemic therapy. So if you have disease in multiple areas, let's say you have breast cancer here and you have breast cancer here, well, surgical removal of this breast mass, radiation to this breast area, does nothing for the disease that's not in that area. So when we talk about systemic therapy, such as chemotherapy, chemotherapy goes everywhere. It goes to the breast, it goes to the lungs, it goes to the bones. And so we have to look at, well, where is the disease? If the disease is very localized, then we tend to use local treatment. If the disease is systemic and looks like it's trying to spread, then we would typically employ systemic therapies. So the best indicator of whether or not the disease is trying to spread is actually by evaluating what we call lymph nodes. And so lymph nodes are basically channels that your body uses to help move fluid balance and help your immune system. And what we see is that your body is full of lymph nodes. And cancer actually uses the lymphatic system or lymph nodes to help spread from one organ to another. So when we evaluate somebody for breast cancer, we definitely look at the mass and the tumor itself within the breast. But another important aspect is there any unusual lymph nodes that are trying to indicate whether or not the breast cancer is trying to move from the immediate breast area? And so the lymph node status is something that's very, very important. So once you're diagnosed with breast cancer, again, the ultimate treatment modality is going to be surgery first. Okay. Once we do the surgery, we'll then have a better idea whether or not there's any lymph nodes that are involved that will ultimately determine the potential for spread of your disease. And from there, once you know the ER, the PR, the HER2, and also the lymph node status, those are the main important indicators that we would look at. And so there's also another important aspect of breast cancer called staging. We also look to see whether or not there could be any evidence of distant spread. That's definitely another topic that requires another session. But those are the basics of breast cancer. If you have any questions, feel free to comment. Feel free to share this with anybody who's unfortunately been affected. And if you yourself or your family members have been affected, just know that our thoughts are with you, and I'm wishing you the best. I hope that you found this video informative. Thanks again, and you have a great day.